morning, friends. I am Dr. N Shahi, Senior Consultant Physician at Maharaja Agrawal Hospital, Dwarka and NKS Hospital, Gulabi Bagh, New Delhi. Today, I will discuss how to take care of heart in diabetes patients. So, its complications and impact on heart, as well as preventive measures for people with diabetes to prevent heart disease. At present, heart disease remains the leading cause of hospitalization and death in patients with diabetes. Although most people have heard of heart disease, few understand exactly what it involves and in turn may not be taking proper steps to reduce their risk of heart disease. Heart disease occurs when blood circulating to the heart is slowed or stopped because of a clogged artery. What can be the reasons behind block in the artery? One of the major risk factors is high sugar level, also known as diabetes. So let us know, what does the diabetes exactly mean? Diabetes is a lifelong disease that affects the body's ability to control blood sugar level. In simpler words, it is the condition in which the body has too much glucose in the blood. So let's understand why does this happen. Usually when you eat food, the glucose enters into the bloodstream. Further, the insulin, which is a hormone, it breaks down glucose from the blood into your cells to be stored or used for energy. With diabetes, your body either does not make enough insulin or cannot effectively use the insulin to break the glucose. This leads to high sugar levels in blood, which is called diabetes. Did you know diabetes can increase your chances of dying from heart disease? It's true. With diabetes, you are more likely to have a heart attack. So, when it comes to diabetes, prevention is very important, as it can affect your whole body, from your eyes to your feet and especially your heart. In fact, people with diabetes are twice as more likely to have a heart attack or a stroke as people without diabetes. And it is reported that among diabetic people over age 65, approximately 68% die from heart disease. The chance of developing heart disease among people with diabetes is not dependent on how well you manage your glucose levels. So, when we think about diabetes, we should really be thinking about heart disease as well. So, moving on, let us see how high sugar levels leads to heart disease. High blood glucose levels can damage blood vessels. It can worsen cholesterol levels and make blood pressure more difficult to manage. Persistent high blood glucose levels due to diabetes make the blood vessels prone to atheroma. Atheroma is a condition in which there is narrowing of the blood vessels due to collection of bad cholesterol. When the blood vessels narrow, blood flow in the arteries is decreased, and due to decreased blood flow in the organs, particularly in heart and brain, there are heart attack or brain attack. There are a number of things you can do to lower your risk of heart disease. Understanding the connection between diabetes and heart disease is the first step towards prevention. Diabetes is commonly referred to as lifestyle disease. It is not a disease of days or months. So managing diabetes requires patients to make significant and lifelong changes in lifestyle. These changes require a lifelong commitment from the patient. One can control blood sugar levels to help lower the risk of heart disease by changing lifestyle, such as eating healthy heart foods, engaging in physical activity, regular blood glucose monitoring, quitting smoking, and relieving stress. So let us see each of these preventive strategies in detail. So know your diabetes levels. In diabetes, we should think about ABC of diabetes. That is the A for A1C test. The A1C is a blood test that measures your average blood glucose level over the past 3 months. It is different from the blood sugar check you do each day. You need to know your blood sugar levels over time. The A1C goal for many people with diabetes is below 7, but it should be individualized. And so ask what is your goal to your doctor. B for blood pressure. So blood pressure is the force of your blood against the wall of your blood vessels. If your blood pressure gets too high, it makes your heart work too hard. The blood pressure goal for most people with diabetes is below 140/80 mmHg. It may be different for you. Ask what your goal should be. C for cholesterol. There are two kinds of cholesterol in the blood, that is LDL and HDL. LDL is bad cholesterol because it can build up and clog your blood vessels. It can cause a heart attack or stroke, that is brain attack. HDL or good cholesterol, it helps remove the bad cholesterol from your blood vessels. Ask what your cholesterol number should be. Your goals may be different from other people. If you are over 40 years of age, you may need to take a statin drug for heart healthy. It should be LDL, it should be less than 70 in most of the diabetic patients. Coming to healthy and well-balanced diet, there is a no one size fits all approach to healthy heart, but it is important to have a regular meal pattern and make healthy food choices. Your fat and carbohydrate intake are crucial to managing both diabetes as well as heart disease. So make simple switches from saturated to unsaturated fat. Having too much saturated fat can increase your blood cholesterol levels. So it's important to reduce the amount you eat and instead get fats from unsaturated sources. Like switch butter and ghee for unsaturated vegetable oils and spreads such as sunflower, olive, rapeseed or corn oil. Trim visible fat from meat and remove the skin from chicken. Choose lower fat milk and dairy products and swap biscuits, cakes and chocolate for healthier snacks such as fruit. Remember, fatty foods are high in calories and excess energy results in weight gain. To help you manage your weight, it's also important to keep an eye on the total amount of fat you are consuming. Different fat types have different effects on the body. Diets high in saturated fat are linked to higher levels of bad cholesterol, that is LDL, in the blood. Eating unsaturated fats instead of saturated fat helps to maintain healthy cholesterol levels in the blood. So eat right. Avoid refined wheat breads and cereals, potato chips and fries, red meats and processed meats, saturated fats and sugar sweetening beverages. Eat foods with more fiber such as whole grain cereals, dairy foods, beans and legumes, lean meats and fish, nuts and healthy oils such as olive oils. Choose foods such as fruits, green leafy vegetables, bread and cereals, and low fat or skim milk and cheese. The next is cut down on salt. Too much salt is linked with high blood pressure, a major risk factor for heart disease. Most of the salt we eat is already in processed foods, so check the levels and go for those with the lowest salt content. Learn how to read food labels to help you make healthier choices. Remove the salt shaker from the table to stop you adding extra salt. Try adding flavor to your food using herbs, spices, black pepper and lemon juice in place of salt when cooking. Here are some tips diabetic patients should consider. Eat balanced diet. Eat a reasonable amount of calories. Eat regularly at the right time. Never skip your meals to keep your blood sugar level down. And eat slowly. Next is try to maintain a healthy weight and engage in regular exercise. Weight loss may improve your cholesterol and triglyceride levels, blood pressure, and your diabetes. So start with low intensity, short duration workouts and gradually increase intensity and time. Gradually increasing intensity and duration of exercise is important. Be careful. If you already have complications of diabetes, aerobic exercises such as walking, swimming or cycling is recommended for patients for more than 3 days a week. The next is medical treatment for diabetes. Take your medications exactly as prescribed by your doctor. Eat meals and take medications regularly at the right time. Always remember that there is a risk of hypoglycemia. If you delay your meal time or eat less than usual, medications must be supported by healthy eating and regular physical activity. Next is quit smoking and stopping harmful use of alcohol. These are especially important. Unfortunately, many people who have diabetes, they smoke. Smoking increases the risk of developing type 2 diabetes as well as diabetic complications. It increases insulin needs and increases the risk of hypoglycemia. Smoking cessation is considered an essential part of diabetes care. And cope with stress as best you can. Stress is known to raise blood sugar. Instead, try meditation, deep breathing or another relaxation techniques to beat stress in a healthy way. Quality sleep is another key to good health for heart. Get at least 7 to 9 hours of sleep nightly. So the bottom line is diabetes can lead to serious medical complications, including heart disease, but you can manage the conditions with medications and lifestyle changes. Avoid the most common diabetic complications with these preventive tips. Thank you.